chart. So there are 10 regional offices across the country, and our staff that work in these different offices, they represent several different parts of HRSA. So as I said in the beginning, I work for the Office of Intergovernmental or External Affairs, or IEA. We are one of the components of HRSA that has regional representation. And what that means is I actually am a resource to you here in Region 7. So for the community colleges in Missouri, it is the Missouri Community College Association. So I am a resource to MCCA, to all of you here in the region, along with my colleagues from the Bureau of Health Workforce that are present here in the region. And so my job really is to do the work on the ground. We serve as a central point of contact and a representative for HRSA, and to help to facilitate connections to our other federal, state, and local tribal partners. We connect you to the partnerships that we have, as well as to our own resources. We help to broker relationships with and among our partners, and we do a lot of outreach and education. So hosting a lot of different grants workshops, presenting on the resources that we have available, that is a part of the job. And this slide we like to include just so people are aware of some of the things that we do. I do a lot of conferences, grants, workshops, but we also host some of our own events like the Advancing Health Equity Among Hispanic Latino Populations. And you all can sign up to be a part of our email list to learn about what we're doing out in the community. And then we include this slide so that you all know I really am a resource to you when you should contact me. If you have any, any questions at all about HRSA, HRSA IA, or HHS as a whole, I am a great point of contact to get you connected to any of those resources. So reach out. But that's my HRSA overview. I'll get right into the Bureau of Health Workforce. So like I mentioned before, HRSA has over 90 different programs. 50 of those programs sit within the Bureau of Health Workforce. They have a mission to improve the health of people by strengthening the health workforce and connecting skilled healthcare providers to communities in need. So their workforce aims include increasing access to quality services, making it easier for people to get the type of care they need, balancing the supply of healthcare workers with the demand for care, and working to increase the supply of future health professionals, improving the distribution of the health workforce by encouraging individuals to train or work in geographically underserved areas, and ultimately improving the quality of the workforce. And so all the opportunities and resources that I'll promote today will fall within these program aims. So the first opportunity I want to mention is the National Health Service Corps Nurse Corps program. These are actually scholarship and loan repayment opportunities for individuals to apply for. So as a student, you can apply to the Nurse Corps program if you are currently attending an accredited school of nursing. That includes the ADN all the way up to the registered nurse and the nurse practitioner as well. They're included in that list. It's accredited schools of nursing include Diploma School of Nursing, the Associate Degree School of Nursing, and then any collegiate school of nursing as well, and beyond that graduate level. So the purpose of these programs is to help with the recruitment and the retention of our health workforce. For students that are eligible and are able to receive the scholarship, the ask is that you serve in a health professional shortage area for a minimum of 2 years, depending on how much money we're giving you. So if you get 2 years of funding, the expectation is that you serve in a health professional shortage area for at least 2 years as well. And again, if you are a student that's a part of the scholarship program, you don't have to find these job opportunities on your own. You will have a project director that's assigned to you, working with you to make sure that you are placed and you're able to satisfy the requirements of the scholarship. The loan repayment option is going to be for, again, registered nurses, advanced practice registered nurses, and then those higher advanced nursing degrees as well. But these will be for the people who are already working out in the workforce. So for anybody working at a community college now, that any nurse faculty that are working at your schools, they're also eligible to apply for this program. They just have to be working for a critical shortage facility. Okay. The next opportunity that I'll share, or just the eligible clinicians for that list. So this list is pretty expanded. It goes licensed clinical social workers, marriage and family therapists. But I think what's applicable for the community colleges are the registered nurses. They're a part of that program. And then if you have any students that are interested in going beyond the registered nursing, then they know that there are resources for them if they are wanting to be a doctor, if they are wanting to be a nurse practitioner or a physician assistant. There are resources available to support their education. We use this Health Workforce Connector, the tool that we created to show job vacancies for students that are part of the NHSC Nurse Corps program. It lists sites that are across the nation. So if your student's wanting to work, in a rural area in Texas or in a rural area in Missouri, they're able to put in their zip code and find open job opportunities. And we will use this tool. The Bureau of Health Workforce project officers will use this tool to help students get connected. But students are also able to go on the site themselves and look at the open opportunities that they see. We usually list a point of contact to each facility so students can reach out and say, hey, I'm graduating, interested. I'm a part of the NHSC program. Would love to learn a little bit more about your program. So that information is available to them, and it is a really great resource. Folks that are NHSC sites can also post their job opportunities. So that's the two ways that we use this connector. It's for students and people who are part of the NHSC program receiving the scholarship or receiving the loan to look for job opportunities, but also for our sites to post their open availability. So outside of individual opportunities, we'll go into some opportunities that we have specifically for schools. So the 4 opportunities there, I'll go into more detail for some of them in the next slide. That scholarship for disadvantaged students. I have a specific slide for that, so we'll go in more detail in that in the next slide. But we have other 4 loan programs that we offer to schools. The loans for disadvantaged students, health professional student loans, and then our nursing student loan program as well. Each loan is long-term, low interest. Students then, similar to the NHSC program, if they're receiving loan repayments, they are expected to work in those health professional shortage areas as well. So how these programs work is your school, the community college, would apply for this funding. We would disperse it to you, and then you all would give out the loan with the expectation of it. It is a loan, so students do have to, repay that money. And then we like to note each state has a state loan repayment program. The Missouri has the state loan repayment program and the health professional loan programs. They're administered by the Department of Health and Senior Services, and they're designed similar to the NHSC Nurse Corps programs to increase access to care for Missourians in health professional shortage areas. So I said I'd mention a little bit more. So the scholarship for disadvantaged students, it is a forecasted opportunity. I want to throw a caveat out there to say that all of our funding is based on congressional appropriation. So Congress has to choose to fund our opportunities, and the fiscal year for the federal government started October 1st. So we are waiting to hear and see when these opportunities will be forecasted and open. So forecasted means that we anticipate that they will open at some point in the future, and Congress has to fund it, and then we'll get a date and you will be able to actually apply for the program. So a little bit more about the Scholarship for Disadvantaged Students. The purpose of the program is really to promote diversity among the health profession workforce by providing awards to eligible health professional and nursing schools. So the School of Nursing would apply to receive this scholarship funding from HRSA. You all would disperse the scholarship as a school. You'd make your own eligibility. We have some requirements that are part of the program, but the award funding was, I believe, a total of $40,000 per student. And that includes tuition, reasonable education expenses. So living expenses, books, and all of the things are included in that scholarship for disadvantaged students. Okay. And yeah, entities, this specific opportunity is, I want to mention just the eligibility without reading that entire list there. It's for-profit nursing schools, they're eligible. So I included that because of registered nursing programs through the community college. And then we have career development diversity programs. These programs are pipeline opportunities. The state of Missouri actually has an area health education center already. They do serve the full state of Missouri. They have different centers throughout the state. The purpose of the AHEC is really just to develop and enhance education training networks within communities, academic institutions, and community-based organizations. So the Missouri AHEC, the federal AHEC, covers, again, the full state of Missouri, offering youth programs. So those programs are designed to expose students to the world of health careers. They also offer clinical training, making it possible to train medical, nursing, dental, and other allied health professionals. And then they offer a lot of like a digital library of health science resources. They provide some collaboration and partnership support as well. So that's a little bit about the AHEC. That funding we do anticipate to open again, but you all already have one. So congratulations on that. Highly recommend, if you've not engaged with the Missouri Area Health Education Center, that you do so. I can also be a point of contact to you if your students are interested in health careers and they'd like to learn a little bit more. They offer internships, and so does the Health Career Opportunity Program. The purpose of the HCOP is to assist students from disadvantaged backgrounds to enter and successfully complete health professional schools, preparing students to meet the admission requirements for the next level of education and receive health profession degrees or certificates. Eligible applicants for this program include schools of nursing, schools that have allied health programs, public and non-private schools, as well as schools of nursing. So that's a really great opportunity as well. We don't have an anticipated forecasted date for this, but the last funding was released and we gave 31 awards with a total amount of $650,000. Okay. And then our other two programs on that list, they are the Centers of Excellence program. It is more so designed for graduate level programs, so I'm going to skip that one, but we've already talked about the scholarship for disadvantaged students. And so shifting again from, supporting those scholarship-based or, professional development courses, we also offer academic institution funding to build health workforce education. So each of those different sections in the primary care medicine we won't touch on today, but we'll mostly focus on the nursing workforce development programs and the behavioral health workforce development programs. The behavioral health workforce programs train professionals and support workers in effective treatments to increase access to services in rural and underserved communities. And then that nursing workforce development program, they're going to create a curriculum. They're going to, if you have an LPN program and you want to have a registered nursing program, we have funding to help you create that pipeline, to create that bridge program for students to advance their education. And so there are a couple of opportunities within the nursing workforce and the behavioral health workforce programs that I'll mention in greater detail. The first one being the Nurse Education Practice Quality and Retention Program. This one specifically is a pathway to registered nurse program. The purpose of it is to create a pathway for academic training to clinical practice through the creation and implementation of licensed practical nurses or licensed vocational nurses to registered nurses. So it's a bridge program. Eligible entities include schools of nursing, including community colleges. So not just those at the baccalaureate level. If you are wanting to create a registered nurse bridge program, there is funding available. This specific opportunity in the past, we released 8 awards, with the award ceiling being $1 million. And we do anticipate that this forecasted opportunity will open again. Again, I don't have dates, unfortunately. The next opportunity I'll mention is the Nursing Workforce Diversity Program. The purpose of the NWD is to increase nursing education opportunities for individuals who are from disadvantaged backgrounds. So this includes racial and ethnic minorities and then underrepresented registered nurse population in general. So eligible applicants include, again, accredited schools of nursing, and that includes those accredited schools at the community college level. In the past, we released 29 awards, with the award ceiling being $555,000. And so shifting specifically from nursing only into the behavioral health workforce, we have this, we call it the BWET program for paraprofessionals. The purpose of it is really to develop and expand community-based experiential training to increase the supply of students preparing to become peer support specialists and other behavioral health related paraprofessionals, while also improving the distribution of quality behavioral health workforce. So a special focus is placed on knowledge and understanding of specific concerns, special areas being focusing on children, adolescents, transitional age youth, and high need, high demand areas at risk for behavioral health disorders. This opportunity was released, is forecasted to be released. I don't, again, have a date, but in the past, it was released and we gave 31 awards. We are anticipating that this opportunity will have a project start date of September 1st, 2025. So I would anticipate the application to open December 20th, 2024. But again, it's forecasted. Congress has to put money in the pot for this opportunity to come live on the grants.gov site, okay? And again, community colleges are eligible for this program. And then the last opportunity that I'll mention is the Opioid Impacted Family Support Program. The purpose of this program is to support training programs that enhance and expand paraprofessional knowledge, skills, and expertise to increase the number of peer support specialists and other behavioral health related paraprofessionals working in integrated interprofessional teams, providing services to children, specifically children whose parents are impacted by opioid use disorder, and their family members who are in guardianship roles. So providing support to children and their families. This specific notice of funding opportunity, in the past, we released 19 awards, the award amount being $600,000. And the eligibility requirements for this does include community colleges as well. So outside of funding, these opportunities we just like to mention because the community health workforce is growing, and we did release funding 3 years ago to support the growth of community health worker training. We released $225 million, and then we also released the Public Health Scholarship Program. These opportunities are in the end of their project period, meaning that the funding for these opportunities will end September 2025. And so we anticipate, we hope to see these opportunities forecasted again, and being able to fund community health worker training programs throughout the state, as well as that Public Health Scholarship Program. That Public Health Scholarship Program, currently the only grantee in Region 7 is the University of Nebraska Medical Center, but they do release the funding to students in all 4 of our states. So if you have any students in community college wanting to pursue public health career or degree beyond what the community college offers, we do have that opportunity, and UNMC does still have funding for students that are wanting to advance their degree in public health. So those are the opportunities that are listed within our Bureau of Health Workforce. I'm going to switch gears and talk about another office, the Federal Office of Rural Health Policy, or FORP. They are the office that focuses specifically in our rural health. They focus at the local and state level. They really help to coordinate activities. They help to develop policy and offer, really sound information to Congress when they're making decisions on what opportunities need to open to help strengthen rural health care networks, to help strengthen rural health in general. So the opportunity that I'd like to mention, and this is an opportunity that I see open on an annual basis. I've worked for HRSA now for 3 years, and this opportunity is always something that pops open. So the Rural Health Network Development Planning Program, the purpose of it is really to promote the planning and development of integrated rural healthcare networks. This program supports 1 year of planning and brings together members of the healthcare delivery system, particularly those entities that may not have collaborated in the past, working to establish or improve local capacity to strengthen rural community intervention. That's a lot of words to basically say, we want you to build a network of people using this funding. We give you $100,000 to build a network for you all to come together and create a plan to address a need in your area. We release additional funding for the people who receive our planning grant for the implementation, the Rural Health Network Development Implementation Program, to actually put into practice whatever it was that you created in that year of planning. So this opportunity, we do have an idea that it will be released in the fall of 2024. Again, award ceiling for this is $100,000, and we gave out a total of 30 awards last year. So those are all the funding opportunities. I apologize that none of these things are open, but we do hope Congress will make those decisions soon. I do want to kind of just go through some resources that we have to support you, not only for looking for data, or if you're wanting to apply for HRSA funding. I want to give you some resources to help you in that process. Again, I think I mentioned in the beginning, we host a lot of grants workshops, so it's my job to kind of go through the federal grant application process. And if you have never applied for federal funding, please contact me and I can help walk you or your grant reviewer, your grant writer through the process of what it's like to apply for federal funding. I can't help you with your application because it's a conflict of interest, right? Being the ones that release the funding, but I would love to help you kind of get started if you've never registered for federal funding. So our data warehouse is a tool that we love to promote out. When you're applying for federal funding, data is a necessity to include in your grant application. So we provide all of the data for you, specifically if you're wanting opportunity, if you're wanting some funding surrounding supporting the health workforce. We have a lot of different dashboards that will show shortages in your area. You can also, if you want to see what your neighbor is doing and see if they have any funding from us, you can look in our data warehouse and see who has funding in your area. And I say that because we never like to reinvent the wheel. I highly recommend, if you know somebody, you can go on our dashboard, and if you know some of these schools or organizations that have received our funding, reach out to them. I can help to connect you to some of our past grantees. And if they're doing something you'd like to replicate, that's okay. You can replicate it. You can redesign a project that actually exists and is working because you know the organization that has it in place. So that is a thing you can do with our data warehouse. But we have the health professional dashboard. It'll show you the retention of clinicians in your state, the clinician dashboard, the projected shortages of clinicians. You can look at our projection dashboard to see what the projection is for the health workforce, if you're looking to create different programs to support the health workforce at your school, you can look at that projection dashboard and say, we're seeing a high need for, allied health professionals. Maybe we'll create a curriculum and use some HRSA funding to design that curriculum so that we can address the need in our community. So those are the different ways you can use our data warehouse. We also list a whole bunch of other data outside of the health workforce on the warehouse. So if you are in a rural area and we're releasing that rural health network development planning and you need to prove that you're in a rural area, you can use our data warehouse for that as well. And then the Midwestern Public Health Training Center is just a resource to you. They work to develop different courses for public health professionals. They create podcasts. They release a lot of information on different public health topics. But they also offer internships, so it's a great organization to know about for your students, especially for those students who are wanting to get some hands-on practice in communities. So we like to promote them as well, and then they work with other public health agencies to deliver workforce needs assessments, as well as providing different information on the website there. So that is a snapshot of their website. If anybody would like to be connected to the Midwestern Public Health Training Center, please let me know. My email will be at the end of the slides here. And of course, we are grant givers, so I always like to give people a place that they can go and look for our funding opportunities. I will say our website is pretty dry right now. Again, we are waiting on Congress to approve a lot of things so that we can release our funding opportunities. But this would be the place that you can go to search for our opportunities. We post on our website past and open opportunities. We post the past NOFOs because if it's something that's going to release again, and we know that it's going to release, I can send you a past notice of funding opportunity. They do not change from year to year very much. So your organization can kind of read over the past notice of funding opportunity, do your research, kind of build the team that you're wanting to work on this project with. And then when it releases, you've already begun that background work, because when you're applying for federal funding, you have about 45 to 90 days to submit your application on top of doing your other job, right? If you're not a grant writer hired by your organization to do this work and you are a faculty member and you're trying to write this grant application, that's not a lot of time. So we give those past NOFOs for organizations to do their own research. I can connect you to some organizations that have received the opportunity that you're wanting to apply for. are able to kind of assist in connecting you with them so you can have conversations and again, do your research to see like, yeah, this is something that we can do. And we would like to replicate a program that's working well. So that's our funding opportunities site. You can also go to grants.gov, grants.gov. Grants.gov lists funding opportunities beyond HRSA. So it's a federal site. All federal funding opportunities will be listed on the grants.gov site. So if you're looking for behavioral health programs and you're wanting some funding from the Substance Abuse and Mental Health Administration or SAMHSA, you can use that site. The same thing for the CDC. They have a lot of internship and health workforce grants. You can look for their funding opportunities through the grants.gov site as well. And then we'd like to always mention the Rural Health Information Hub. They are a grantee of ours created from our funding. It's the National Clearinghouse on rural health information that provides resources to support healthcare and populations in health, specifically in rural communities. I love their website. They do a really, really great job of providing a lot of different resources. So they also post past notice of funding opportunities, people that were successful in submitting their applications. And they also do the work of following those programs. So you know that they're working well in the community. They will also post funding opportunities on their site, federal opportunities from the state foundation funding. Rural Health Information Hub will post it. You can search by keyword, you can search by state, you can search by topic to find the opportunities that you're wanting or interested in. But besides funding, they also provide a lot of data support and help. So if you have something that you're wanting to do in your community and you need some data to kind of back up your application, they will do a data search for you. They also provide a lot of technical assistance. And what I mean when I say technical assistance is you can call the RHI Hub and say, hey, this is an issue. This is a challenge we're seeing. Do you have any resources to support this challenge? And they'll be able to help connect you to different resources and organizations. So love their site. And then we always like to promote the National Maternal Mental Health Hotline. There are free posters that are available, free magnets, free wallet cards, all of the things. This hotline is not a crisis line. So I hope that you all are familiar with the 988 number that my SAMHSA colleagues are promoting out. This is not that. It is a 24/7 free confidential support line. People are talking to professional counselors, and this line specifically is designed for new moms, their families before, during, and after pregnancy. So you could be dad calling because you're looking for different resources to support your family. You could be grandma calling, you could be mom calling this hotline just to provide support. If mom is having a rough time and really just wants to talk to somebody, this is a great line for that as well. And then for your students, this is a resources we like to promote out. We fund federally qualified health centers across the nation. Our health centers provide care regardless of people's ability to pay. So patients may qualify to receive care at a reduced cost or free of charge, depending on their economic status. This is a really great resource for students and really anybody. A lot of our health centers are a part of our 340B drug pricing program. So if you are on a medication and your medication pricing is high, you can go to one of our health centers utilizing their pharmacy, and we can sometimes take a $250,000 bill down to 12. So really like to promote that out because it's a really great way to support health for students that are in school and, for faculty that are wanting to use our programs as well. So we also have the same thing for persons living with HIV. Our Y-and-White HIV programs provide care for persons living with HIV. Same thing, regardless of their ability to pay, that sliding fee scale, care is available. And then I'll end here with this resource document. If you scan that QR code, it will take you to this document. We have compiled a list of our health workforce resources in one place for you all to, kind of work through. I lead health workforce projects for our team. So if you don't want to look through the list, then you can contact me, and my contact information is here. Numbers there, emails there as well. Please feel free to reach out if you have any further questions. But I have a little bit of time here, and hopefully I was able to kind of give back some time. Does anyone have any questions for me in the room?
Hello, you had mentioned if we've never applied for a federal grant that you'd be able to assist us. Well, our college recently received a federal grant in our allied health program for the first time, and I can tell you they're freaking out because it's a DOL grant and they're used to educational DESE grants. So they are looking for all kinds of resources. Would you be someone they could contact as they kind of navigate their federal grant for questions that they would have or that they're running into?
Yeah, so when you receive a grant from any federal entity, you have a project officer that's attached to that grant. So if they got the grant from the Department of Labor, then they should have a project officer assigned to them. And I would contact them with any questions they have specifically for the grant, because the Department of Labor is going to be very different than the Health Resources and Services Administration and our requirements. If they are wanting to find a point of contact, I can help them with that.
Thank you. Any other questions? All right. Thank you, Ms. Kennedy. We really appreciate you joining us today. Thank you for your time.
Thank you so much for having me. Have a great evening. Bye.
You as well. Okay, as we wrap up the day, our next speaker is Brian Milner, who is the MCCA president and CEO. He is going to do a legislative update, and I think he's coming straight from the highway, right?
Thank you. Thanks, Dr. Hubble, and everybody who's made this such a success. I apologize for not being here earlier, but I've heard it's been